Also, in regards to Dr. K doing sort of like therapy online, it is true that he gets pretty intimate with people and people tend to call it therapy and people don't know what therapy is, because I do think that we think that this is therapy in the same way that people think what I do is therapy. Look, therapy is very specific and it's different in different bubbles, but what I do on the internet certainly isn't therapy, right? We're not even a psychology channel.
And the reality is most people who watch it, they're like, yeah, it's not therapy, but it's therapy, right? That's the whole issue. And so absolutely the DTR needs to be more clear. And if he's genuinely saying that he's not doing therapy, he needs to make it more clear how he is not doing therapy. I don't think he's engaging in psychiatry, but he is doing therapy.
Dr. K doesn't do therapy on the internet, though I do think because of his position as a therapist, he should be more cautious about the ways that he talks to people on the internet about their problems.
Because
if therapy happened, then the ethics then would apply. And at that point, it might be a dual relationship. Well, it definitely would be.
Do you think therapy happened?
It sure looks like it, but I don't know what the ethics board is going to decide, because in their stated contract,
I'm not asking what you think the
happening.
ethics board thinks. I'm saying, do you think therapy happened?
Again, I'll say it again.
I don't want to hear you say it again. I'm asking you to say a fucking new thing. Do you think therapy happened, yes or no, or you refuse to answer?
No, I don't think so.
Okay.
And if he's genuinely saying that he's not doing therapy, he needs to make it more clear how he is not doing therapy. I don't think he's engaging in psychiatry, but he is doing therapy.
That is sort of the issue that I think comes about just because he is a licensed doctor and all of that. That puts people in a position of thinking this is therapy. And look, therapy is different. You don't have to necessarily be a medical therapist. You can be a lot of different kinds of therapists.
And even before, even there's competing therapeutic models between therapists that disagree on what therapy is. So the idea that there's like a consensus on this is obviously therapy. Like somebody that works in psychodynamics or psychoanalysis is going to disagree with somebody that works with other models or like that. Yeah, no, I don't know. That's kind of silly, I think, to say that it's obvious.
So I was being taught therapy, and I started to spread my wings a little bit and incorporate some Eastern philosophy, meditation, some of these concepts like karma. Not karma because that's really unscientific. But I started to spread my wings a little bit and then actually found that, got some negative pushback from some people. So one of my therapy supervisors, so when you're training to become a psychiatrist, you have supervisors who supervise you in therapy. So I go and I do therapy with my patients, and then you go and you talk to your therapy supervisor, and sometimes they sit in and they watch you do therapy. So one of my therapy supervisors said, I don't know if I can supervise you because I don't know what you're doing, but it's not therapy.
I don't think he's engaging in psychiatry, but he is doing therapy.
And I was kind of taken aback, and I was like, I'm not sure what you mean. And then she was saying you're doing something, but it's not therapy. It seems helpful. So I'm not saying it's bad. It's just not therapy.
And then, of course, there's so many different kinds of therapy in the world. So I don't want to sit here and say your form of therapy is invalid. I just want to say that what Dr. K does in therapy, therapeutic practice as a medically licensed therapist.
I don't know if I can supervise you because I don't know what you're doing, but it's not therapy.
Is different than what that shaman did with Boogie when they took shrooms together. Okay?
Yeah, you're doing something, but it's not therapy. It seems helpful. So I'm not saying it's bad. It's just not therapy.
These are different things, And so even though it feels therapeutic, it's not exactly backed with the understanding of the science.
It's not science. It's politics and economics. That's what psychiatry is. Politics and economics. Behavior control. It is not science. It is not medicine.